Hello, I'm Dr. Kaczynski, and this is Plastic Surgery One-on-One, your internet source for answers to your questions about plastic surgery. Today we're going to talk about a very basic question, and that is, what's the difference between Botox and fillers? And this is a question that I get all the time. And even though after you heard this, you'll know all of the differences between Botox and fillers, if you're new to thinking about this, it can be quite confusing because both Botox and fillers involve needles, they involve syringes, they don't involve surgery, they involve wrinkles, and they involve making you better. So it's logical to think that you could confuse them because you don't know where one part goes and where another one goes instead. So let's talk about Botox first. Botox is a purified protein that is delivered in a syringe, and what this does is it freezes or temporarily paralyzes certain muscles in your face. Your face has many, many muscles. Some of them are very strong, and some of them cause excessive wrinkling. By putting in small amounts of Botox, this purified protein, in precisely the right places, we can temporarily freeze those muscles and improve the wrinkles in those areas. Unlike the urban legends, unless you put in thousands of dollars of Botox, it's not going to freeze your face. You're not going to look like a Stepford wife, and it will not make you look like a space alien. But what it does do is on your face, you have certain muscles, and these muscles cause certain wrinkles. First one we'll talk about is the corrugators. This is a muscle right here, just above your eyebrows, and that's the muscle that pulls your eyebrows together. It creates those wrinkles, either 2 or 1 or 3 wrinkles between your eyes that go in a vertical direction. Another muscle is the frontalis muscle, and that's a muscle that goes up and down your forehead, and when that muscle contracts, it gives you these lines, which is the horizontal lines, because as you'll notice, when the muscle contracts, it's like clothing or cloth contracting. The sign of the muscle contraction is at a right angle to the direction of the muscle. The third major muscle is what we call the orbicularis oris, and that's a different muscle in that it's a circular muscle. And when this contracts, it gives you crow's feet. Now there are other applications which we would call minor applications down around the lips and the chin, but we'll just stick to these because these are the vast majority of uses of Botox. So by making judicious injections, we can freeze these muscles and soften these lines. For the corrugator, it involves basically 5 injections. They may vary depending on your brow type, but that's kind of a standard injection protocol. For the forehead, It's usually about 4 injections, and then an injection across here, just under the skin for those muscles. The benefit, if you're doing the corrugator, is that this is also a pulling down muscle. So if we freeze this particular muscle, you actually get what's called a chemical brow lift, because it actually lifts this up, the frontalis muscle. What's left of it from the freezing is lifting up the forehead. Now, if you do a lot of work up here, because there are a lot of wrinkles up here, then you don't get quite as much of a brow lift, and you could actually get a drop. But by just putting the Botox in these areas with the smallest needle that we use, and it's a very simple outpatient procedure, we can actually improve all of these particular wrinkles. Now, the problem with Botox, or one of the issues with Botox, is that it only lasts about 4 months. So to really keep these wrinkles under control, you have to use the Botox regularly, because the wrinkles will come back. I recall one patient who had a very deep wrinkle right in the middle, and it took about a year for that wrinkle to absolutely disappear. And that was from the continued and regular use of Botox. So, just to recap, Botox freezes temporarily certain muscles in the upper half of the face and takes care of certain wrinkles in the upper half of the face. Now, you could ask, well, why not just put in a filler and puff up these wrinkles and fill them up? The reason that won't work is as long as the muscles are acting, as long as they're active, what happens is they keep squeezing and they keep contracting and bunching up the skin, and the wrinkles continue.